let's talk about the example, saying carpal tunnel. So carpal tunnel has been around for a long time. It was first reported back in 1933. Very common, but sometimes misunderstood. Matter of fact, it's one of the most common surgical procedures that one sees, especially with hand surgery. The average age is usually around 54 and occurs a little more in females. But what are the symptoms? A person may have numbness and tingling sensation. So you would feel as though your hand is falling asleep. You may wake up, it may wake you up in the middle of the night. It wakes you up in the middle of the night, you shake your hand, and it feels better. This could be early signs of carpal tunnel. Now, different treatments for that, which is very important. I always like to say, okay, just because you're going to a hand surgeon doesn't mean you need surgery. So that's another thing. The big thing with carpal tunnel, you don't want to wait too long because then it's an entirely different problem. Because if you catch it early enough, you may not even need surgery. So the problem sometimes is waiting too long to be treated. So non-operative treatment. So we're first going to say, you come in, you may have carpal tunnel syndrome. We diagnose it, history and physical. Guess what? You may wear a wrist splint. The thing is, you wear the wrist splint at night, not through the day, not 24 hours around the clock, because that can make it worse. So we'll say, oh, put on the wrist splint. Let me tell you why. So your nerve, and you'll see a couple diagrams, is going through the wrist. And I look at it like a garden hose. Sometimes at night when you're sleeping, we have a tendency to curl. When you curl, you're bending that nerve. Now that nerve is getting inflamed, is bothering you, it wakes you up in the middle of the night. So what do? You put a wrist splint, and now that nerve is nice and straight, is not bent. Sometimes that may be all you need, and that can solve the problem. Now, let me tell you about wrist splints. There's also going to be some exercises you would do, and there may be some activities that can make it worse. For example, construction workers using a jackhammer, that could really flare it up. This is why you hear with certain activities or jobs, you're prone to carpal tunnel. Anti-inflammatories sometimes help. Now, splints. You see a splint here. Sometimes you have to be careful because you can just go to the store and say you may get a splint, but you don't want to get the wrong one. I may use this splint here, but not necessarily for carpal tunnel. This could be an injury or pain in the small finger. Another one, this could be for arthritis of the thumb or tendonitis, not necessarily carpal tunnel. So I've had a number of times when someone would come in, they thought they were treating themselves, but they had the wrong splint. Therefore, we had to start all over with treatment. Now, so you use a splint. Say it helps a little bit, but not quite all the way. Some things we do, sometimes we give a steroid injection. Again, this is non-operative treatment. It may treat the problem. Again, it depends on how long you've had it. It goes back to the history and physical. It's a non-operative treatment. And this, even I mentioned here, 20% of people may be symptom-free in 18 months. So that may almost cure carpal tunnel. However, if it's been going on for a while, we may use it for another reason, just to get some insight to make sure that's the right diagnosis. Now, everybody does not need to have steroid injections. And some people should not have steroid injections. So again, this goes back to the history and physical. For example, some diabetics, if your sugars are poorly controlled, that steroid injection could make that sugar really go up. So again, every person is different when they come in, but these are things we would talk about. What happens if steroid injection doesn't work or it comes back? Guess what we might be talking about? Yes, surgical treatment. So, say we get a test. There's one other thing I didn't mention before. Sometimes you get a nerve study. A nerve study will tell us how irritated that nerve is. Is it mild? Is it moderate? Is it severe? All those have different treatments. For example, if it's severe, more than likely we're talking about surgery. If it's mild, chances are we're not. Or it could be coming from something else besides the wrist. That could be coming from the neck. You can get the same exact symptoms where that nerve is compressed, but in a different area besides the wrist. So you may hear us talk about a nerve study. So for example, so you have the nerve study, it's moderate to severe. We did all conservative treatment. Maybe we'll talk about surgery. So surgical treatment. What happens? Here at Great Plains, we'll say, okay, let's get a preoperative evaluation. Then you'll go through possibly medical clearance, and then you'll be scheduled for surgery. So the surgery we have, it's not like it used to be. Fortunately, now it's more minimally invasive. Now there's different techniques. And some of the techniques here, you'll see where I draw the lines. It may be a small incision in the palm. If we use a scope, it may be at the wrist, but it can vary. And then for trigger finger, it may be a small incision near the finger at the base. So the good thing about this, the recovery time is so much better than it used to be. Surgeries in the past, huge incision sites. Recovery time used to take forever. Things are very different now, which is beautiful. This little diagram just shows the thickness. It's hard to see, but there's a white thickness up at the top, not too far from that circle there. All it is when we say we're cutting the carpal tunnel or releasing pressure off the nerve, all it is a little fiber we're just releasing so that nerve can breathe. So we'll talk about that in the clinic as well. So carpal tunnel, one of the most common things we see in hand surgery. It's important for you to know, and it's important for even your family doctor to know, because you don't want to wait too long. You want to come get that taken care of.